So, hello everyone, good evening.
Good evening, ma'am.
Am I audible perfectly?
Yes, ma'am. Perfect.
So, how are you all? I think fine. This is our last class.
Yes, ma'am. This is our last class.
So,
We will
how we
miss you, ma'am.
enjoyed through total overall these all the classes actually. How you enjoyed? I think all of you so enjoyed very much, and we both you are and also we the teachers also we are also learning, have a session of gathering knowledge and sharing each other, right?
Yes, ma'am.
So can I start today's class?
Yes, ma'am. You can.
uh, from the first, actually, I also took your first class, that is DVT, and it is a coincidence. Last class also, it is a great honor for me to take your class, and I'm also feel very proud because you are all you are psychologists. We are sharing our thoughts. So now just share my screen. Is it visible?
Yes, ma'am.
Okay. Yes. So today's topic is eclectic therapy. Have anyone any idea about this eclectic therapy? Is it not just common like CBT, DBT, others art therapy, and others therapy also? So is it not such common? So have you any idea what is this? Is it new for to you everyone? Is it new? Totally new?
No, ma'am, we have heard it before.
Have you applied it to your client? Anyone? So we're just starting the concept of counseling. Actually, all of you know we are psychologists, or we work through counseling, and this is the term we use normally, and the laymen also use this more than psychologists. Counseling words more familiar, I think. So counseling actually is the application of mental health. All of you and I, all of you, we know that, and psychological or human development principles through cognitive, effective behavior or systematic intervention strategies that address wellness, personal growth, or career development, as well as pathology also. So, actually, counseling deals with wellness, personal growth, career, and pathological concerns. But in other words, Counselors work in areas that involve relationship also, including intro and interpersonal concern related to finding meaning of adjustment in such setting as schools, families, and office environment, all these areas. So it is conducted with persons who are considered to be functioning well, and those who are having more serious problem. Counseling meets the needs of wide spectrum of people. Clients seen by counselors have developmental or situational concern that require help in regard to adjustment or remediation. Counseling is mainly theory based. So counselors draw from a number of theoretical approaches, including those that are cognitive, affective, behavioral, and systematic. These theories may be applied to individuals, groups, and families. So it is a process that may be developmental or maybe intervening. Counselors mostly focus on clients' goals, so it involves both choice and change. So in this way, so counseling is actually we can say it is a rehearsal for action. So now it is a concept of counseling. So firstly, today's 3 hours long class. So I think I don't know if you feel bored or not. So try to. It is interesting and it is I think interactive. If it is interactive, so we will not feel bored. So okay, so this is a concept of counseling. Next, we can divide it. This is the technique of counseling. That is one directive technique, non-directive technique, and last one is eclectic technique. That is which is our today's topic. So, what is directive technique? Can anyone say what is directive technique? What is the main concern? In one sentence, you can say what is the directive counseling. Just say anyone, what is the directive counseling? Who is
Therapist has the main role.
sorry?
The therapist has main role in this rather than.
Yeah. So in this first one, that is directive counseling. We can also say it clinical counseling here. Chief component is a E.G. Williamson. It is actually counselor centered. So in this counseling, the counselor plays an active role as it is regarded as a means of helping people how to learn to solve their own problems. So it is actually counselor centered and counselor direct the client to take steps in order to resolve his conflicts. It is based on actually assumption that the client cannot solve his own problems for lack of information. So here counselor analysis, synthesis, diagnosis, prognosis, prescriptions, follow-up, and all these process are done by counselor. So next one is that is non-directive counseling, which is actually client-centered process. And Carl Roger is the chief component in this viewpoint. It is actually just reverse to the directive counseling. In this type of counseling, the counselee or client or not the counselor, counselee or client is the plays main role, active role, not the counselor. So in this counseling, the goal is the independence and integration of the client rather than the solution of the problem. They create the environment and they help the client to solve their problem and to find the solution. In this counseling process, the psychologists, normally we do this type of counseling. In this counseling process, the counseling comes to the counselor with the problem. The counselor establishes rapport with the counselee based on mutual trust, acceptance, and understanding. And the counseling provides all information about his problem. The counselor assists him to analyze and diagnosis his difficulties, predict the future development of his problem, and take a decision about the solution of his problem. And also analyze the strength and consequence of the solution before taking a final decision. So actually, the main function of counselor is to create an atmosphere in which the client can work out his problem. So we can say also it is a permissive counseling. This is another term of non-reactive counseling. So now come to the today's topic, that is the third technique of the counseling, that is eclectic technique. So first we say that what is the eclectic approach to therapy. First, it is the formal definition, that is the eclectic approach to therapy requires the therapist to tailor treatment to the needs of the patient. It allows for a customized form of treatment as the therapist can deploy multiple methods of treatment. So, in this counseling process, most discussions of eclectic therapy involve combined the therapies, not a single therapy. So, if I just create an example, that is an eclectic therapy, if a psychologist uses mindfulness for a patient to teach a patient mindfulness, to teach a patient to think about their negative thought or feelings before reacting. After that, the psychologist switches to imagery to teach the patient to think about a happy place. The patient thought patient thought is to visualize this place and use it in a method to distress. So it is the combination of two therapy, that is, one is mindfulness. First, psychology relax him with mindfulness, then to distract this thought. So switch to imagery technique, and that is the client can visualize this a happy place and to distract this for the distraction. So this is the example. Next one is, actually most discussions of eclectic therapy involve combining two theories or approaches, and each therapist operates out of his or her unique set of techniques based on the particular training, experience, and belief. So, actually, there are no specific guidelines or principles for eclectic therapy. Eclectic therapy can take many paths depending on the approaches invoked by the clinician. For this reason, it may seem structured at first. There are no structural any model like this. Actually, the clinician in front of the clinician, there are no structured any model. So it may seem unstructured. And working with the therapist, clients may try different techniques before treatment become more consistent. So it is a system, or it is a process of that eclectic technique. So in this case, there are three sets of characteristics which are called the central therapeutic ingredients, and these are mainly the one is the therapist's ability to be integrated, mature, genuine, and congruent. Secondly, the therapist's ability to provide a non-threatening, trusting, safe, and secure atmosphere by his acceptance, non-possessive warmth, unconditional positive regard or love. And lastly, the therapist's ability to be accurately empathetic with the client, be understanding, or grasp the patient's meaning. So these are the main three sets of characteristics of this eclectic therapy. The therapist can actually the quality of the therapist. So other counseling intervention, it appears that there is a general agreement that the relationship provided by the therapist, the basic common characteristic of like all approaches of psychotherapy. So if we just find the history of eclectic therapy, we can see that until the 1970s, these therapeutic theories were separate from each other. Or there are one type of therapies, and the psychologists can they can treat their client through this single type of therapy. So as time passed, research continued, and as more therapeutic approaches were developed, so people began to see that more than one type of therapy was effective than single one. And by the 1970s, therapists began to use multiple approaches in their work with clients. One of the earliest proponents of an integrated approach to therapy that was Arnold Lazarus with his multimodal therapy. Actually, he's the first person who used this multiple therapy, and this is called, and he named it multimodal therapy. Through the 70s and 80s, so different type of eclectic therapy were developed, and they continue to evolve. So you see this in our, when we actually all of we asked when we treated the client, actually we use this multiple therapy, right? Have you any experience about it? Can anyone just use only one therapy and treat? I think all of you use this multiple therapy. Can anyone share any experience about this use this multiple therapy? Orijit, Adila, anyone? In any case, just share your experience. You use that multiple therapy, so like CBT or RBT or DBT or mindfulness, relaxation. Mostly We just started, we actually starting the our therapy with relaxation process, then we go to CBT and others, so on, so on. Right. So actually, we use this multiple therapy in our practical life also. So still today, new eclectic therapies are emerging as research continues into what makes psychotherapy effective for different people with unique challenges. The eclectic approach of psychology includes creating individual plans for patients based on their needs. And an eclectic therapist may choose as a means of treatment from variety of disciplines and may use a range of proven methods to determine the best combination therapeutic tools to help a patient. So, if we just go through some methods, it is a list that are theoretical approaches from which an eclectic therapist may choose as a means of treatment. There are lots of therapy. So, the behavioral therapy, cognitive therapy, dialectical behavior therapy, person-centered therapy, psychotherapy, and many of this. So, we just go to a little some 2 or 3 sentences, just go through this therapy. What is actually behavior therapy? Behavior therapy, the type of therapy, does not consider emotions or thoughts, but instead focuses on observable behaviors. What is CBT? You just learn the CBT before 2 or 3 classes. So CBT actually is the form of therapy. It is actually relies on behavioral techniques, but the difference is that the CBT adds a cognitive element, focusing on the problematic thoughts behind behaviors. So this form of therapy focuses on changing negative thoughts that lead to depression and other conditions. The therapy works to identify and analyze the patient's negative thoughts. The therapist then works to help the client replace the damaging thought with more meaningful positive thought. So cognitive cognitive behavioral therapy or CBT focuses on changing the automatic negative thought that can contribute to and worsen our emotional difficulties, depression, anxiety, so on, so on. And these spontaneous negative thoughts also have detrimental influence on our mood. Through CBT, faulty thoughts are identified, challenged, and replaced with more objective and realistic thought. Next one, which we learn in our first class, that is DBT, dialectical behavior therapy. This therapy, it is a form of CBT that utilizes both behavioral and cognitive techniques to help people learn to manage their emotions, cope with distress, and improve interpersonal relationship. And this therapy is used to help the patient be able to better regulate their emotions and improve tolerance skills. Have you remembered the technique of DBT? Anyone? Have you remembered the techniques of DBT? Hello? Are you there? Have you remembered any technique of DBT? That is
Yes, ma'am.
say, tell me, what are they?
Mindfulness, distress tolerance.
Yeah, and there are some acronym also improve distress tolerance, and others are
Emotional regulation and
yeah,
interpersonal effectiveness.
yeah. Have we used Dearman training client? So it is very effective, this technique. So actually, this therapy is used to able to control to regulate their to regulate their emotions and improve tolerance skills. So next one is uh, 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 okay. A therapist will also choose specific techniques from within that theoretical approach. Some examples that is others technique also REBT, social learning therapy, exposure exposure therapy, experimental therapy, relaxation therapy, ACT, systematic therapy, etc., etc. Just my previous slide. I just define some what is person-centered therapy, what is client-centered therapy or person-centered therapy. This therapy allows the patient to have a hand in coming up with their own solution through leading the discussion session. The therapist takes on more of they actually play the a facilitator role. So it is in this client-centered therapy involves a therapeutic environment that is comfortable, non-judgmental, and empathetic, which is achieved through three features. These are: one is genuineness and congruence. Second one is unconditional positive regard. Third one is empathetic understanding. So by these three techniques, therapists can help clients grow psychologically, become more self-aware, and change their behavior via self-direction. So in this type environment, a client feels safe and free from judgment. So this is client-centered therapy or person-centered therapy. So if we mm, if we tell about the ACT, the acceptance and commitment therapy. So what is this? These are actually, it is a type of psychotherapy that emphasize acceptance to deal with negative thoughts, feelings, symptoms, or circumstances. So ACT encourages increased commitment to healthy, constructive activities that upload a client's values or goals. So ACT has six processes. One is first one is identify values, where these are the areas of client's life that are important enough to motivate actions. It is about recognize what a client want to be about and stand for. Next one is commitment to action. This process of ACT involves changing your behavior based on principles covered in therapy. These specific actions can either move us closer or further towards values. The third process of ACT is self as context or self as observer. This involves learning to see your thought about yourself as separate from your actions. So, by doing so, people can make space for their thoughts and feelings without becoming entangled with them. And fourth one is Cognitive diffusion skills. It is a skill that is separating a person from their inner experience, and this allows a client to see thoughts simply as thoughts, strips away importance that your mind adds to them. So, exercise that can help in this include imagining your thoughts on clouds and then watching them drift away, making connection between thought and values, or singing thoughts and silly words. Uh, Fifth one is that is acceptance. This means allowing your inner thought and feelings to occur without trying to change or ignore them. So acceptance is an active process. Last one is present moment contact. So ACT therapy encourages a person to stay mindful of your surroundings and learn to shift your attention away from internal thought and feelings. So these involves the consciousness and deliberate effort to focus on the world around you in the moment. So in the uh, psychodynamic therapy, it is an intensive type of therapy based on Freud's psychoanalysis. It calls for, actually, it calls for a deep analysis of the patients and how they fit into their own world. Psychodynamic therapy, through working this therapy, people are able to better understand their thoughts, their feelings, and conflicts that contribute to their behaviors. And this approach to therapy also works to help people better understand some of the unconscious motivations and sometimes influence how people think, feel, and act. This approach to psychotherapy can be helpful for dealing with mental or emotional distress, and it can help promote their self reflection, insight, and emotional growth by better understanding emotional patterns of thoughts and their roots. So, a person is better equipped to manage their problems and develop coping techniques that will help them both now and in the future. So, this is the therapy of psychodynamic. If you we go the experimental therapy, so when we think of experimental therapy, talk therapy generally comes to our mind. Normally, talk therapy comes to mind, but experimental therapy, on the other hand, it is the name actually, it is the form of therapy that involves immersing a person in a certain experience. Actually, it is an action type of form. In this therapy, a therapist uses tools like role playing, psychodrama, music, poetry, art and crafts, props, animal interaction, and outdoor excursion. So, all these are the experimental therapist process. Some others therapy, just wait. Okay. So that is REBT. REBT, we also learned REBT just before 2 or 3 class. So REBT focuses on identifying negative or destructive thoughts and feelings. In our last class, we actually we have learned about REBT. So people then actively challenge those thoughts and replace them with more rational, realistic ones. They can think it rationally and take decision and the irrational and form a rational belief, and its consequence there are a rational consequence will happen. So next, the social learning therapy is It actually centers on how people learn through observation, observing others, being rewarded or punished for their actions can lead to learning and behavior change. We learn this social learning therapy, and the person who is developed this therapy, can you remember his name? Social learning theory. Who is the person who developed this theory? Social learning theory, observational theory. Vandura. All of you, we learn and know about Bandura's social learning theory. So it is can lead to learning and behavior. After observation, a person change their behavior pattern. So it is another therapy, and then relaxation therapy and mindfulness. We know this as a DVT class, and also relaxation, muscle relaxation, mindfulness, mindfulness and meditation. My meditation technique. This is also therapy, and the last one is systematic therapy. So systematic therapy is actually it is a form of one of the form of psychotherapy that focuses on how an individual's personal relationships, behavior patterns, and life choice are interconnected with the issues they face in their life. Systems theory has been applied to individual, family, and group therapy. Some examples that are normally used this systematic therapy, some specific issues like addiction and substances abuse. In this case, the systematic therapy can help individuals identify what factors actually in their life may have contributed to their substance abuse. It provides treatment that emphasizes the connection between an individual's drug or alcohol addiction and how it affects other aspects of his or her life. Anger management issue. Many people with anger problems never learned appropriate ways to express feelings of frustration and anger. So, systematic therapy helps individuals understand how anger can be expressed in damaging ways that affect their relationships and interpersonal communications. Mood disorders. It also people with depression or bipolar disorder often have long standing issues they may need to work through before they can address the more immediate symptoms of these mental health problems. So systematic therapy also helps in this case. Relationship difficulties. Sometimes couples or families come out therapy hoping to learn how to communicate more effectively with each other. So, systematic therapy can help them identify hidden issues that maybe help them to mutual understanding and create a platform for evolving more effective ways on interacting. Conduct disorder. This is also a childhood condition marked by aggressive and destructive behavior. So, this therapy can help individually improve impulse control, develop appropriate social skills, and understand how family dynamics may be influencing their actions. Anxiety, eating disorders also have long lasting issues, and it is also systemic therapy helps individuals in eating disorders feelings of inadequacy and how they affect decision making related to food or exercise. PTSD, it also helpful through for in systematic therapy. who have experienced traumatic events understand and how the memories of their events are affecting their current lives. Schizophrenia also in some cases individuals help through this systematic therapy. So all these are therapy, eclectic therapy. Choose any from any this any this different type of therapies. They can choose from them, and they utilize this therapy by combined two or therapy, combining this therapy and treat their client. So it is all the methods mainly where the eclectic therapist take help from this list. So one of the first early proponents of eclectic therapy, that is we just before some 2 or 3 slides, that is cognitive therapist Arnold Lazarus used the term multimodal to describe this method because he would use different modes or approaches to help patients. Lazarus proposed that the most complete form of therapy evaluates 7 different modes, that is behavior, affect, sensation, cognition, interpersonal relationship, and biological processes. So there are actually 3-stage model. This form of eclectic therapy is newer than the others. It is developed by Clara Hill around 2014. The 3-stage model provides therapists a framework of 3 stages of the therapeutic process. Knowing what happens during each stage helps professionals select techniques that will work for an individual client during each stage of therapy. Finally, these 3-stage models are: the first stage is the exploration stage, and it is based on the Carl Rogers person-centered therapy. In the first stage, called exploration, as patient examines their thoughts and feelings. The second stage is the insight stage, based on the psychoanalytic therapy. The therapist helps a patient to understand the underlying reason behind their thoughts and feelings. And finally, in stage 3, the activation stage, based on cognitive behavioral therapy. And in this stage, the patient makes changes. So these are the 3-stage model. Till now, have you any confusion or any questions about this? Till now we have discussed. Have you any questions or any queries? Any confusion? So just this is some model that is this about this exploration stage, insight stage, and activation stage. So what is this? That is actually these are the process through which the therapist can treat their client. Okay. So next one is, just a minute. Okay. Mhm. Okay. So actually, what are the types of eclectic therapy? So first, over time, practitioners and researchers have created specific types of eclectic therapy. First one is, that is brief eclectic therapy. So brief eclectic therapy, that is BET, is a specific approach to helping clients deal with and overcome a traumatic event. Actually, it is used in the PTSD case. So, in this brief eclectic therapy, so it is a specific approach to for helping clients deal with and overcome a traumatic event. It combines two type of element, that is, one is CBT and psychodynamic therapy. And in CBT, actually, they focus on the negative thought, and in psychodynamic therapy, uh, that focus on interpreting and processing emotions and thought. So it is a brief eclectic therapy, and in this therapy, a focus of brief eclectic therapy is on the emotions of guilt and shame that often occur in the aftermath of a traumatic experience. As the name suggests, that this is a short-term form of eclectic therapy, and that are applied over a limited number of sessions, often to address a specific problem. So, the approach actually uh, has been used to treat PTSD by helping people make meaning out of their traumatic experience and develop new coping strategy. So, it is a very useful process of brief this eclectic therapy. So next one, that is multi-modal therapy. Just we discussed earlier, that is developed by Aaron Lazarus. So it is the therapy that is actually based on social and cognitive learning theory. The theory, that social learning theory and cognitive learning theory, that we discussed earlier, all the therapies. So it is actually draws on techniques from numerous different mental health therapies. So eclectic therapists using a multi-modal approach to determine their clients' needs by assessing a number of criteria in 7 modalities of being, which can be remembered by acronym BASIC, BASIC, BASIC ID. So, in this way, they can help each client in specific and personal ways. So, what is basic ID? So, the acronym basic ID is, just wait, behavior. First one is behavior, which actually emotion part of the part of a client. So, first is B for behavior. Second one is A for affect. That is also a emotion part of a client. Wait a minute, first one. Third one is, that is sensations. that is actually senses, which reflect our senses. So sensation is S for sensation. That is, we actually the therapist actually use the sensory therapy in this through this through the sense organs. So it is one of the part of therapy. Next one is imagery, visualization and imagination that we just discussed earlier. That is two example, that is first mindfulness, then switch it on imagery therapy, that is visualizing a happy place to distract their negative thought. So imagery is I for imagery, that is visualization and imagination. Cognition, that is language based thinking. It is C for cognition, that is also a process. And I for interpersonal relationship. And last one is D for drugs or biology, that is including physical bodies and health. All these are the basic ID, that means behavior, affect, sensation, imagery, cognition, drugs and biology. So in this way, they can help each client in specific and personal ways. Okay. Third one is, that is cognitive interpersonal therapy. This therapy actually utilizes aspects of cognitive behavioral therapy to help people understand how their thoughts influence their relationship. It is actually the combinations of CBT, cognitive therapies like CBT, with interpersonal therapy. These two type therapies combine this in this part. So it is a methodical approach to helping people become aware of and understand their distorted thoughts about themselves and the relationship that causes problems in their lives. This approach actually utilize aspect of CBT to help people understand how their thoughts influence the relationship, their career, their individual's problem, etc. So it is helping the people to aware and solve their and find the root cause and solve their problems in their life. So last one is actually the trans theoretical therapy. James Prochaska and Carlos Di developed this approach that pulls concepts across theories to explain how people change. This approach focuses on understanding the stages and process of making a change. Using this knowledge, people are then able to work on achieving their goals, improving their relationships, and creating positive changes in their lives. It, it combines actually theories about the stages of change, level of change, and the process of change, working from their understanding of how people create positive, effective change in their lives to accomplish their goals. Therapists select techniques from the variety of therapies to help clients do this through this uh, therapy of through this type of therapy of eclectic theory. So last one is, that is cyclical psychodynamics. What is this? That is actually another newer type of eclectic therapy. And Paul Watchit's actually is a this is his ideas, and is driven by a strong therapeutic. It is driven by a strong therapeutic relationship. These therapy actually combines psychodynamic therapy, CBT, systematic therapy, and experimental therapy. All were discussed earlier slides to improve our clients' emotional experiences and help them develop a new interpersonal relationship skills. So, these are the types of eclectic theory that the therapist used by combinations of variety of therapists, and uh, it is helpful to many mental disorder or uh, relationship cases and solve the clients, help the clients to solve their problems. So, how is an eclectic approach different from a specialized approach? So, in eclectic therapy, skilled therapists tailor their work to what is the best for the client and their challenges rather than adhering to a single theory as a one size fits all approach to helping. Just in one umbrella. They fit on in fitting one umbrella. If there is a some helping theories like CBT and DBT, for an example, uh, actually these are the structured and methodical, and the clients learn the all the information, strategies, and techniques that are this part of the particular model. It actually in contrast, an eclectic therapist might select some aspects of CBT and DBT and other theories that make sense for a specific client. Actually, they just uh, choose some part of the this therapy, some parts of the technique of this therapy, and combine the with other therapy, and they treated the treat the clients. It is important to know that the eclectic therapy is far from a random hodgepodge of ideas applied haphazardly to clients. Indeed, ingressional theories don't grasp at straws in an attempt to find something, anything that will help, but instead are intentional in the approaches they choose with each client. So it is actually multiple potential therapy techniques which will vary depending on the specific strategies. So the client can the therapist can this way help the client and put in all the therapies in therapy in one umbrella so that they can help the client. So there are multiple technique. So the common technique used in the eclectic approach include exploring unresolved issues from childhood, challenging negative or distorted thinking patterns, teaching coping skills, increasing motivation for change, identifying source of social support, building a strong relationship between therapist and patients. And the eclectic psychotherapist will make use of a combination of these different techniques. So, actually, how these how it is possible the therapist to choose the techniques which the particular combination is right. So how can they choose? So actually there are different type of eclectic therapy can help you to create peace of mind and confidence and build up confidence. But the therapist isn't simply using a trial and error approach. They consisting of technique randomly, but they have to definite about the technique, definite about the combination. They cannot use it randomly. So it is there are some concepts. So how they choose and what they do. So, despite the fact that it is a flexible and pools for multiple therapeutic approaches depending on the needs of the client, but it is a very intentional approach to mental health therapy. Therapists purposefully select techniques based on established criteria. So, regardless of how integrated therapists choose their approach, everything they do customized for an individual clients and the difficulties they are dealing with. So they some practitioners use a specific type of eclectic therapy in their work with clients. So in this case, there are three general concepts that define how therapists choose what they do. So first one is the theoretical integration. These actually refers to a conceptual or theoretical creation beyond a mere blending of techniques. This path has the goal of producing a conceptual framework that synthesizes the best of two or more theoretical approaches under the assumption that the outcome will be richer than either of the theories alone according to each client's needs. For example, a counselor combine the client-centered therapy with CBT to help clients overcome obstacles. This mental health professional would select strategy and ideas from these two theories when working with all clients, and the specific tools used would vary according to individuals' needs. So it is the theoretical integration. Next one is that is technical eclecticism. Technical eclecticism tends to focus on differences, chooses from many approaches, and it is a collection of techniques. Technical eclecticism means that a therapist, rather than adhering to a small number of therapeutic approaches, selects techniques from a wide variety of different therapies depending on what is needed. Here, the clinician selects a technique that is shown by research to help a particular issue. Okay. This requirement calls for counselors to possess knowledge of various cultures, be aware of their own cultural heritage, and have skills to assist a wide spectrum of clients in dealing with the realities of their culture. So they have to necessary to in working with a diverse range of cultural background. Otherwise, it cannot choose the right process. Some common factors. The common factors approach actually attempts to look across the different theoretical systems in search of common elements. Although there are differences among the theories, there is a recognizable core of counseling composed of non-specific variables common to all therapies. Some, let's see, that's all. There are some common factors always happens within all therapies. There are some difference. There are some common factors. So therapists choose the common factors from their wide range of therapies. So gratify, uh, therapists gravitate towards the underlying belief system of therapies, such as unconditional positive regard, hope, trust, and empathy, as well as driving factors like correcting emotions, changing belief, or providing honest feedback to clients to help them see themselves more clearly. Actually, each theory has its unique contribution and its own domain of expertise. So, by accepting that each theory has strength and weakness, all theories has some strength and weakness, some limitation, and is by definition different from others. Practitioners have some basis to begin developing a theory that fits for them. It is important to emphasize that unless counselors have an accurate, in-depth knowledge of theories, they can't formulate a true synthesis. So it is very important to have the idea, the sense of all therapies. So, what can the okay? So, and the individual, and it can be used in individual as well as group also for overcoming the stresses and others and the problem. So, but now we can see that what type of in disorder that the eclectic therapy will helpful. These are mostly all the mental disorder it will helpful. That is major depression, glycemic disorder, postpartum disorder, bipolar disorder, eating disorder, personality disorder, marriage, family or other relationship struggles, developmental challenge and issues related to specific stages of life, complicated pregnancy, school-related problems in kids and teens, coping skills for medical problems, health issues, so on, so on. All these are the problems that, in that case, all these are the issues in this the eclectic therapy can be helpful to solve this problem. So there are some following examples we can put, that is regarding how therapists might approach treatment for clients with anxiety, depressions, PTSD, and other also. So we know that anxiety disorder are extremely common, and but because people have different personalities, backgrounds, and current life experience, so anxiety is different. Anxiety is different for anyone. So to an integrational therapist, a single method of helping every client with anxiety would be inadequate. So they have to maintain the combination of technique, combination therapy to treat anxiety. So, so how can they treat the anxiety patient? After learning more about the client and their experience with anxiety, an eclectic therapist would create a plan that draws from first acceptance and commitment therapy. Next one, that such as in this SCT therapy would help a client to stop struggling against anxiety and begin living fully in their present moment rather than stuck in worries about the past and future. The therapist, the behavioral therapy, that is, the therapist would select specific CBT techniques like learning about automatic negative thoughts and thought stopping to help clients changing unhealthy thinking that is contributing to anxiety. So in this way, they first accept the after hearing the problem, the therapist help clients to accept the struggling moment, accept the against anxiety, and in which moment they actually stuck. And the second point is they actually then learning how to uh, uh, learning about their negative thoughts, automatic negative thoughts, and learning how to stopping this negative thought and change unhealthy thinking that is contributing their anxiety. And third one, that is positive psychology. Though in the statement process, the therapist should eventually add techniques from positive psychology, like that is identifying and using character strength to help the client increase self-confidence. So these are the process. In this way, the therapist can help the anxiety disorder patient through eclectic therapy. So next one, that is depression. Eclectic therapy, that is about depression patient. So depression, we know the depression has roots in long-term problems and it frequently involves struggles with interpersonal relationship. Therefore, it is an eclectic therapist might use, they use the psychodynamic therapy and then interpersonal therapy to help a client overcome depression. Firstly, then, through psychodynamic therapy, clients explore emotional difficulties and come to terms with problematic experience from the past. Once a client was ready, the therapist would then select specific treatments from interpersonal therapy to help them develop insights and interpersonal skills to improve relationship and interaction with others. So our next is, that is brief eclectic therapy for PTSD patient. To help people, PTSD patient, to help them face, address, and overcome painful thoughts and feelings in the aftermath of the traumatic event, a brief eclectic therapist combines CBT and psychodynamic therapy. So first, select CBT techniques help clients recognize their particular negative thoughts and about the trauma and changes their thoughts and patterns, while specific psychodynamic techniques allow people to process difficult emotions. So all these are the all these are the technique of PTSD. Just going to see you. Can you hear me? Can you hear me?
Yes, ma'am.
Okay, just my screen is something. Just wait. Okay. Can't see you all. Okay. So all this about the problem, the technique, the problem, and the types of eclectic therapy. So in now I will just come the end of this part about this therapy. Tillo, just tell me what is your experience about this? What is till now? How do you learn about this technique? Till now, have you any confusion or so anything? Just tell me. Next, we can proceed there. Some I can see you actually. See you. Just wait. Some problem here. So, these are the some pros and cons of an eclectic approach. So, till now we have learned this therapy. So, this therapy have some advantage and disadvantage also. Some advantage that is it is flexible to accommodate different clients' needs rather than uh, rather than what rather than a one size fits to all approach to therapy. And it is useful for multiple and complex problems. Usually, people see a therapist for more than one issue for single type treatment or etc. So that is it is actually multifaceted. So they actually not feel not bored. So and there's some excitement and some they changes the uh, by this changing this technique. So the clients also become motivated. So it is useful uh, for them. So the techniques used are research based and shown to be effective, and the theory is adapted to the client rather than a client having to fit into a set model. So it is not particular, actually not, this is a particular model. It is free to the therapist to choose their own and their unique choice, their unique model. So it is flexible for them also. Uh, so next one, what is the actually disadvantage? So it can feel that unpredictable uh, or confusing. Sometimes the client thought that it is so confusing or unpredictable. So it is can mix up. So it is case some problems also. So it might seem like the therapist is using a trial and error approach also. So there isn't a clear, obvious, predictable structure. It is also a problem. So it is the disadvantage also the of this problem. So, but uh, it is uh, it is not only it is clear. It is actually not particularly clear. So that it is though it is quite versatile. So counsel would do well to consider this own personal style, but sometimes it faces some problems also. So uh, in conclusion, we can say that it is this therapy, actually eclectic therapy, is a versatile therapy, and counselors would do well to consider their own personal styles in the process of developing their integrative approaches. And the therapist creates a unique process and selects individualized treatments for each client. So no two people seeing the same therapist will have identical therapy. So it is actually customized. So it is, so for different people, it is the therapist planning is different. So instead, the challenge is to customize a counseling approach that is tailored for each practitioner, and each challenge is different from every person who experiences it. So it is not a common, it is customized, like it is created, it can be planned. So all these are eclectic therapy. So it is about it is very flexible to all of us, that is clients also, and we are the therapists also, as it is a combination and it is a unique process. So most of the therapists adapted this therapy to deal with their client. So these are the slides about eclectic therapy. So now just I want to your comment. I can't see actually. Just wait. Yes. I just join. Just wait. I just stop sharing and then. Okay. Okay. Now all of you. So then any questions, any confusion? Or I just can I just sum up this theory? Would you like to? Can I repeat to sum up this theory? Can I repeat the slides? Is it needed to you, or is it okay for you? So please give me some feedback. How do you understand? It is understand or not? Is there any confusion or not? Are you there? Anyone? So what is Adila, Seema, Orijit, Hasnat? Can you hear me?
Yes, ma'am.
So tell me, can you apply this? Could you apply
Yes,
this
ma'am.
actually? How? Just give me an example, your experience.
In case of
Please on your video, please on your video. Switch on. Yeah. Tell me your experience about.
If like I have a patient who is suffering from post-edic symptoms,
Okay.
so I have tried ERT, exposure and response prevention therapy with her, and with that I also use relaxation technique.
Yeah. So this is the combination of exposure therapy and relaxation therapy.
Yes.
And through exposure therapy, what is the result? What was the result?
She was able to control her thoughts and her compulsions after
Yes.
doing this for some time.
And next, after after that, you relax them through relaxation therapy.
Yes. Can I explain the whole thing?
Hello? Sorry?
Can I explain the whole thing
Yeah.
about it? Okay. So she has the symptom in which she feels the compulsion to hold her breath for 10 seconds when she hears the ambulance sound. And she lives near the NH, like National Highway side. So she hears ambulance sound like all day, every day. And she was having really difficulty because of this. So while she was in session with me, the ambulance was going through the road, and I have told her to put her hands on the table
Mhm.
and don't keep breathing, don't engage in
Okay.
that thing that she was doing before. And she said to me that she is having real difficulty, as she cannot do the like that the thing that she was doing. And because to ease the difficulty, I asked her to keep these things and relaxation also, facial imagery.
Okay. Okay.
Yes, and yeah, it was effective.
Actually, normally, so you already uh, treat treat your clients with this eclectic therapy, right?
Yeah,
Because
right.
you already use this combination therapy. Normally, actually, we use this. So we actually don't know this process. Actually, we already everyone use this technique with combination this, because no single technique is not possible to treat, especially nowadays. Because in first session we have to relax them, right? So we have to actually apply this combination therapy. Anyone has any have any experience? And have you actually applied this systematic therapy or experimental therapy to music therapy, art therapy? Is it? Have you applied this?
No, ma'am, I didn't apply art therapy. But I don't have a clear idea about what art therapy is. I am still researching it.
Okay, okay, okay. So color therapy or art therapy. Okay. And you used only the exposure therapy.
No, no, I have used several techniques actually. And this was like when you asked me about eclectic therapy, I just gave an example from that.
No, yeah, but if you combined with CBT, any technique, any therapy with CBT, combination of CBT, you just tell me that is, you told me access exposure therapy and relaxation. So with CBT and any therapy you used? Normally we use CBT with relaxation maybe, or DVT or relaxation. Relaxation, I think, is the common therapy, relaxation or mindfulness, right?
Yes, ma'am.
And CBT or others, some REBT or others, some other therapy that is just out or others. Any therapy you have used earlier? So, normally you use CBT and exposure.
Yes, only in the case of OCD, I used the exposure therapy.
Okay,
Then,
but in all cases it is not helpful, no?
no,
So
yeah, no, because they don't have these compulsions and all.
yeah, yeah.
Yeah. So, can you
On
give an example of like CBT, like a technique that is used in CBT?
DBT, there is a long technique. There is a many technique in DBT, and it is also helpful to the for the client to deal with to distress. Normally, to control their emotions and tolerance, distress tolerance. So DBT is very helpful. I think CBT.
DBT I use. Yes, DBT techniques I use. But CBT, I think it's cognitive dairy. I think.
Cognitive. You didn't use CBT.
Yeah, like ma'am, this technical. Cognitive, like thought recording, that thing. Uh, like
Notice,
like
sorry,
I asked them to write about the
thought.
yeah,
Thought.
the thought they're having and the distress that like the scale of distress that thought is causing them,
Yes.
and like to replace it with another thought that gives them like because it's a positive thought, and then write the distress and how they are feeling after the changed thought.
Okay.
Isn't
Okay.
that, isn't that a kind of CBT technique?
Yeah. 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 Uh, anyone here? Orijit, Seema? No one there. Actually, where are you? Where are you all? Just log in and out. So, till you have learned how many therapies in this course? And or you submitted all the assignments.
Yes, ma'am. Except the RABT assignment,
RABT. Yeah.
he submitted every other.
And what is your experience about these therapies? And did you actually have you applied? You can apply this. Could you apply this to after learning here from this these therapies by the worksheet? In REBT, I gave you the self form. You find it
Yes,
already.
ma'am.
So in this through this self form, you can fill up. First, you fill up by own, and then you can just try to your clients. So as they is a format, actually they can put their thought in there. So it is you can try to put it and already you can try to xerox it and give your client, so it is helpful to you also. And you got any worksheet like this from other therapy? DBT I will give you a worksheet also. So I
Yes,
don't
ma'am.
know. I don't know
You,
others.
yes, you gave the DBT and RABT. I don't remember others giving the worksheet.
CVT
They'll
you
give
have.
a material.
Oh, you don't get any worksheet. You didn't get any worksheet.
No,
It's a,
ma'am. I don't remember.
you can buy this worksheet. You can use in your to your client also.
Okay, ma'am.
Hmm.
Ma'am, where can we find the other materials like this sheets and all?
This material, yes.
The worksheet, where
Okay,
can we access this?
okay, okay. Only materials. So it is practically, actually, it is needed practical to actually to help. This is help you to practically practical knowledge. So you through this worksheet you can do it practically. So it is necessary because all this theory you have already you have knew the theories, but you have to implement this. No. So you have to implement this. So try to search, find the worksheet and others also. So I think no one there. So all let's just see at the YouTube and then solve the. Actually, live classes. When I took the first class, it is more interactive class. So I can. That's from last class we just saw that one or two persons are present there, and rest are all see it in follow the YouTube. So just let's wrap up this. No? So thank you for joining. Just close the session. So this is all about type. You understood, no? The technique, eclectic therapist technique type, all these are. Have you understood?
Yes.
Okay. Just follow the slide, and you have already. You also got the study material also, and assignments. Just to complete the activity, then I will give the assignment. Okay. So thank you, Ankur. No, you can leave now. Okay. So,
Thank you, ma'am. Your classes were very nice. I really enjoyed.
okay. Thank you.
And it was very informative.
I actually more participants needed. So if the class will be would be interactive, so it is enjoyable for me also. So just one-to-one science. I think let I just talk. Just go on the slides. Go on. If any not any questions arise from your side, so it is if it is not interactive, so it is not enjoyable, I think. Okay. So okay. So are you there, Orijit, Seema? I think no one there. So okay, I can leave now. So thank you. Good night.
Good night, ma'am. Thank you.
Okay. So Seema, okay. Okay, Seema. So I'm leaving the meeting. Anyone in from MindGuru?